In the landscape of health and wellness, few topics have ignited as much debate as the advent of weight loss drugs like Ozempic. This medication, heralded by some as a miracle for obesity treatment, has raised considerable controversy about its long-term safety and effects. As the scales of opinion teeter between groundbreaking and hazardous, it is crucial to uncover the reality of Ozempic's impact on weight loss and overall health. Ozempic has surged as a beacon of hope for many battling obesity, yet its rapid ascent is shadowed by growing concerns over potential health risks. This video explores Ozempic, dissecting its efficacy and hazards. Hello everyone, and welcome back to our channel. Today, we're diving deep into a topic that sparked a lot of interest and debate: Ozempic and its use for weight loss. Is it really the weight loss miracle some claim it to be, or is there more to the story? Whether you're considering it yourself or just curious about the buzz, this video will give you all the details. So, let's get started. Just a quick reminder, this video is intended solely for educational purposes. Please consult with your healthcare provider for any medical concerns or questions. Ozempic, scientifically known as semaglutide, is a medication approved for managing diabetes. Recently, it has gained attention for its weight loss benefits.
First up, let's talk about what Ozempic actually is. Ozempic, or semaglutide, is a medication approved primarily for managing type 2 diabetes. It works by mimicking a hormone that targets areas of the brain involved in appetite regulation, which can lead to decreased hunger and calorie intake. But its effects have reached beyond just diabetes management, catching the eye of those in the weight loss community. This medication not only helps in managing blood sugar levels, but also promotes weight loss by reducing appetite.
Ozempic mimics GLP-1, a hormone that regulates appetite.
This simulation of GLP-1 reduces hunger, aiding significant weight loss. The process is fascinating as it tricks the body into feeling fuller for longer periods, thus reducing overall calorie intake.
Moving on to how it works and how effective Ozempic is for weight loss. Studies reveal that Ozempic can reduce body weight by 15 to 24% within a year. Ozempic slows down digestion and affects appetite signals in your brain, making you feel fuller longer. This mechanism is why it's gaining popularity for weight loss, as it directly influences caloric intake. But how effective is it really? Studies, including large-scale clinical trials like the STEP series, have shown significant weight loss results, with some participants losing up to 15% of their body weight. Its effectiveness is notable but varies among individuals.
Ozempic's side effects range from mild nausea to severe gastrointestinal issues and beyond.
Here's a detailed explanation of the risks associated with Ozempic. 1. Gastrointestinal issues. Common side effects of Ozempic include nausea, vomiting, diarrhea, stomach pain, and constipation. These symptoms can often be bothersome and may lead some patients to discontinue treatment. 2. Pancreatitis. Ozempic has been linked to an increased risk of pancreatitis, which is an inflammation of the pancreas. Symptoms include severe abdominal pain, nausea, vomiting, fever, and a rapid pulse. This condition can be severe and requires immediate medical attention. 3. Hypoglycemia. Especially in patients taking other medications for diabetes such as insulin or sulfonylureas, Ozempic can increase the risk of hypoglycemia, low blood sugar levels. Symptoms of hypoglycemia include shakiness, dizziness, sweating, hunger, irritability, or trouble concentrating. 4. Kidney problems. There is some evidence to suggest that GLP-1 agonists like Ozempic can affect kidney function, particularly in patients who already have kidney disease. This might manifest as a reduction in kidney function or kidney failure in severe cases. 5. Diabetic retinopathy. Patients with a history of diabetic retinopathy may experience a worsening of their condition when using Ozempic. This is thought to be due to rapid improvements in blood sugar levels that Ozempic and similar drugs can cause. 6. Allergic reactions. Although rare, some people might experience serious allergic reactions to Ozempic. Signs of an allergic reaction include swelling of your face, lips, tongue, or throat, difficulty breathing, and severe rash or itching. 7. Thyroid tumors. In animal studies, semaglutide caused thyroid tumors, including cancer. It is not known if Ozempic will cause thyroid tumors or a type of thyroid cancer called medullary thyroid carcinoma, MTC, in people. Patients with a family history of MTC or those who have the genetic condition, multiple endocrine neoplasia syndrome type 2, MEN2, are generally advised to avoid using Ozempic. 8. Increased heart rate. Some users of Ozempic report an increased heart rate, which can be a concern for individuals with certain cardiovascular conditions. 9. Mood changes and depression. Mood alterations and depression have been reported, though it's unclear if these symptoms are directly linked to Ozempic or other external factors. 10. Impact on pregnant women. The effects of Ozempic on pregnancy are still under scientific scrutiny, with concerns about its safety for pregnant women. 11. Malnutrition. The drug can suppress appetite significantly, which may lead to inadequate nutrient intake and subsequent malnutrition. 12. Cultural and psychological impact. Concerns about how widespread use of such weight loss drugs might affect societal attitudes towards body image and eating behaviors, potentially leading to unhealthy body image perceptions and behaviors among non-obese individuals. 13. Stomach paralysis. A condition known as gastroparesis or stomach paralysis can occur, where the stomach takes too long to empty its contents. 14. Aging of facial skin, Ozempic face. Users might experience sagging and premature aging of the facial skin, a side effect popularly referred to as Ozempic face. The determination of whether the benefits of taking Ozempic, semaglutide, outweigh the risks depends on individual circumstances, particularly the health profile and treatment goals of the patient. However, for many individuals, especially those with type 2 diabetes or significant challenges with weight management, Ozempic has shown considerable benefits that may justify its use despite potential risks. Here's a detailed exploration of how the benefits of Ozempic can outweigh the risks.
1. Effective glycemic control in type 2 diabetes. Ozempic is primarily used to improve blood sugar control in adults with type 2 diabetes. It is highly effective in lowering blood glucose levels and A1C, which measures average blood sugar levels over 2 to 3 months. Better control of blood glucose levels is crucial in reducing the risk of diabetes-related complications, such as neuropathy, nephropathy, and retinopathy, thereby improving quality of life and reducing overall healthcare costs. 1. Significant weight loss. For individuals struggling with obesity or significant weight management issues, Ozempic has proven to be a powerful tool. It can lead to considerable weight loss by reducing appetite and caloric intake. This weight loss can further help in managing type 2 diabetes and reducing the risk of cardiovascular diseases, which are often associated with obesity. 1. Cardiovascular benefits. Studies have shown that GLP-1 agonists like Ozempic not only help in managing blood sugar levels and weight, but also have cardiovascular benefits. These include lowering the risk of major cardiovascular events such as heart attack, stroke, and cardiovascular death in people with type 2 diabetes who have established cardiovascular disease. This makes Ozempic a valuable option for diabetic patients with a high risk of cardiovascular issues. 1. Convenience. Ozempic is administered only once a week, which is more convenient than medications that require daily or multiple daily dosages. This ease of use can significantly improve patient adherence to the medication, leading to better overall outcomes. 1. Potential for long-term cost savings. By improving glycemic control, aiding significant weight loss, and reducing risks of serious complications, Ozempic can lead to long-term healthcare cost savings. These savings are achieved by potentially reducing the need for other medications, hospitalizations, and treatments for diabetes-related complications. Addressing the risks. To ensure that the benefits of Ozempic outweigh the risks, consider the following. Patient selection. Ozempic is best prescribed to individuals who are most likely to benefit from its effects, particularly those with type 2 diabetes needing better glycemic control and individuals with obesity-related health issues. Monitoring and management. Regular monitoring by healthcare providers can help manage and mitigate potential side effects effectively. Adjusting the dose or discontinuing use can be considered if severe side effects occur. Education and counseling. Patients should be thoroughly educated about how to recognize serious side effects, such as symptoms of pancreatitis or severe allergic reactions, and instructed to seek immediate medical attention if they occur.
Loving the tips so far? Hit that like button, subscribe, and turn on notifications to keep getting the best health and nutrition advice delivered right to you. Ozempic impacts more than just the body, it affects the mind. Reports suggest it could alter eating patterns and mental health, raising significant concerns about the broader implications of its use. There is growing concern that the weight loss facilitated by Ozempic semaglutide may also contribute to a reduction in muscle mass. This phenomenon is attributed to the nature of rapid weight loss, which often results in a combination of both fat and muscle loss. How muscle loss occurs. 1. Appetite suppression. Ozempic effectively suppresses appetite, leading to a significant reduction in food intake. When the body receives fewer calories than required, it may break down muscle tissue for energy, especially if protein intake is not adequately maintained. 2. Metabolic changes. Ozempic slows gastric emptying and alters hormone levels to aid in weight reduction. However, these same changes may reduce the body's ability to synthesize new muscle, especially during prolonged use. Exercise and nutrition deficiency. 3. Rapid weight loss can impact the ability to maintain regular physical activity, and the diet may lack essential nutrients and proteins required to preserve muscle mass. Mitigating muscle loss.
To counteract the muscle loss associated with rapid weight loss, protein intake. A. Increasing dietary protein can help maintain muscle mass during weight loss. B. Strength training. Incorporating resistance exercises supports muscle preservation and even growth. C. Medical monitoring. Regular checkups with healthcare providers can help tailor weight loss plans to minimize muscle loss. Since muscle mass plays a significant role in metabolism and overall health, it is vital for patients using Ozempic for weight loss to work closely with healthcare providers. They should ensure their diet and exercise plans are designed to minimize muscle mass loss and promote a sustainable, healthy weight.
From a regulatory standpoint, Ozempic, semaglutide, has been approved by various health authorities for specific uses based on the results of clinical trials. U.S. Food and Drug Administration, FDA. The FDA approved Ozempic for the treatment of type 2 diabetes in 2017. They deemed it effective for glycemic control due to evidence from clinical trials. The approval specifies its use as an adjunct to diet and exercise, emphasizing its role in comprehensive diabetes management. Additionally, the FDA approved a higher dose of semaglutide, Wegovy, for chronic weight management in adults with obesity or overweight individuals with weight-related health issues. European Medicines Agency, EMA. The EMA authorized Ozempic for managing type 2 diabetes in Europe in 2018. Its decision was based on studies showing significant reductions in blood glucose levels and improved cardiovascular outcomes in patients at high risk of heart disease. Risk management regulatory agencies have highlighted the importance of risk management in using Ozempic. Key considerations include thyroid tumors. Animal studies have shown an increased risk of thyroid C-cell tumors, which has been communicated through a boxed warning on the medication. Pancreatitis. Regulatory agencies caution prescribers to monitor for pancreatitis symptoms given the potential risk. Gastrointestinal issues. Agencies stress managing gastrointestinal side effects to ensure patient adherence. Risk management. Regulatory agencies have highlighted the importance of risk management in using Ozempic. Key considerations include thyroid tumors. Animal studies have shown an increased risk of thyroid C-cell tumors, which has been communicated through a boxed warning on the medication. Pancreatitis. Regulatory agencies caution prescribers to monitor for pancreatitis symptoms given the potential risk. Gastrointestinal issues. Agencies stress managing gastrointestinal side effects to ensure patient adherence. The prescription of Ozempic, semaglutide, raises significant ethical questions among health experts, particularly regarding long-term health impacts. Here is a summary of their assessments. 1. Weight loss in non-diabetic populations. The growing popularity of Ozempic as a weight loss solution among non-diabetic individuals has led to ethical concerns about its off-label use. Some experts worry about the drug being prescribed for cosmetic purposes rather than medical necessity, which may exacerbate societal pressure to conform to specific body standards. Furthermore, this practice can limit access to the drug for those with type 2 diabetes who genuinely need it for glycemic control. 2. Long-term health impacts. While clinical trials have demonstrated Ozempic's effectiveness for weight loss and glucose management, limited data is available on its long-term effects. Health experts emphasize the importance of monitoring for potential complications, such as pancreatitis, gallbladder issues, and the development of thyroid tumors. These unknowns present significant ethical challenges in prescribing Ozempic, as patients may not be fully aware of the long-term risks. 3. Muscle mass loss and nutritional deficiency. Some healthcare professionals are concerned that rapid weight loss caused by Ozempic could result in the reduction of muscle mass and nutritional deficiencies, potentially leading to frailty and other health issues over time. They recommend careful supervision of diet and exercise to mitigate these risks. 4. Cost and accessibility. Ozempic's high cost may pose a barrier for some patients who would benefit most from the drug. Limited insurance coverage can further exacerbate disparities in access, raising ethical questions about equitable treatment. 5. Mental health impact. There are mixed reports of the drug's effects on mental health, with some patients experiencing worsened symptoms of anxiety and depression. Health professionals advocate for close mental health monitoring of those on Ozempic, particularly individuals with a pre-existing history of mental health disorders. Ozempic could potentially trigger or exacerbate eating disorders, a significant risk for vulnerable populations. The future might bring safer, more effective weight loss drugs. Ozempic paves the way, but caution remains paramount. It's essential to balance the benefits with potential risks.
To conclude our exploration of losing weight with Ozempic, miracle or myth, we must acknowledge that Ozempic offers significant promise as an innovative treatment for individuals struggling with type 2 diabetes and weight management. Clinical trials and real-world usage show its effectiveness in reducing blood sugar levels, achieving weight loss, and reducing the risk of cardiovascular complications. However, its use is not without risks. Potential adverse effects include gastrointestinal symptoms, muscle mass loss, pancreatitis, and an elevated risk of thyroid tumors in specific patient populations. Moreover, ethical concerns arise regarding its off-label use in non-diabetic individuals and its accessibility due to high costs and demand. The significant muscle mass loss and the psychological impact of rapid weight loss require careful monitoring and an individualized approach to each patient's unique health profile. Thus, the decision to use Ozempic must involve a comprehensive assessment of each person's health status and goals. Patients should engage in an informed dialogue with healthcare professionals to weigh the benefits against potential risks, ensuring that lifestyle changes in diet and exercise complement the treatment. Ozempic, like any medication, must be integrated into a broader health strategy that prioritizes long-term well-being over quick fixes. Ultimately, Ozempic can be a valuable tool when used judiciously, but it requires a shared understanding between patients and healthcare providers to ensure safety and efficacy in achieving desired health outcomes.
Thanks for joining us on this in-depth exploration of Ozempic. Whether it's hailed as a miracle or remains shrouded in concerns and ethical debates, one thing is clear. This medication is reshaping the way we think about weight management and diabetes treatment. Remember, health decisions are personal, and the journey requires thoughtful, informed discussions with healthcare professionals. If you found this video helpful, please like, share, and subscribe for more insightful discussions on health and wellness topics. Let us know your thoughts or questions in the comments section below. Stay tuned for future content where we continue uncovering the truths behind today's most pressing health trends. See you next time.